So some of you really are gluttons for punishment, but you're coming back 2 times in a row. So I passed out a flyer at the beginning. Tim's passing out some more. This just talks a little bit about my organization and how you can find more information, because I do realize we're talking about pretty big topics in a short amount of time. So there is an opportunity for you to get additional information later. So the only thing less fun than talking about health insurance is talking about money, right? So I don't know if you guys can read the cartoon, but it's a gentleman talking to his insurance company saying, there's an error in my bill because you accidentally sent it to somebody who has no money. And I think we can all probably relate to this when we've opened up those bills from the doctor's office. So we're going to talk a little bit about managing your finances. Some of this information may seem very basic or elementary. Please realize that the reason we talk about all of these things is because it's always a good reminder that even though these are pretty basic things, that we should all be doing them, whether there's been a cancer diagnosis or not. So Triage Cancer is the organization that I work for, and we are a nonprofit that provides information and resources on all types of survivorship issues. So we host a speakers bureau, we host or go to events all over the country, and then we have a plethora of educational materials on our website that are downloadable for free, in addition to our blog, where we try to put information up on our blog in short, sort of digestible amounts of information, so that if you only have 5 or 10 minutes, you can still get a good handle on a topic. So definitely encourage you to check out our website. It's just triagecancer.org. So when we talk about financial toxicity or financial health, really those things can certainly be impacted by a cancer diagnosis. And so some of the things that specifically impact it are going to be things like medical bills, health insurance status. So if you were in my last session, we talked a lot about how health insurance status can really affect if you end up having to file bankruptcy or not. And it's not about necessarily whether you have insurance or not, but do you have the right health insurance? Employment changes. A lot of times when you're dealing with a cancer diagnosis, something in your employment changes. Whether that means that you have to stop working completely, or maybe you just end up going from full-time to part-time, and so that cuts your take-home pay down, or maybe it changes your health insurance status. And then life changes. And unfortunately, when you get that cancer diagnosis, it doesn't come with a pause button for the rest of life, right? Like you still have to deal with everything else that's going on in life in addition to your cancer diagnosis. So what are some things that can affect your finances? We're talking about things like moving or getting married or having kids or getting divorced. So all of these things contribute to sort of that financial burden that can come along with a diagnosis. So the very first thing that I recommend everybody do, and this can be if you were diagnosed yesterday, if you were diagnosed 10 years ago. I think there's very few of us in this world that couldn't benefit from a better financial position, right? And if you are one of those people, I'd love to talk to you afterwards. So a couple of questions I would suggest asking yourself. So what's the current status of your finances? Did you have to take time off for treatment? Are you back at work? Is it the same kind of job? Or do you maybe need to take a different career path? And depending on those answers, how is that going to affect your finances? So if you were a world-renowned brain surgeon making $10,000 a minute, and now you can't do that type of work, how is that going to change your financial picture long-term? And do you have some sort of stable income? So really these are very general questions just to kind of start getting you thinking about your financial status rather than just feeling overwhelmed by the bills that are coming in, which is an easy place to get to. Also, I recommend thinking about what are reoccurring and potential expenses. So it's not as hard to figure out the reoccurring expenses. Usually you have rent or a mortgage coming out every month. But are you in a situation where you need an expensive scan every 6 months and your insurance only covers a portion of that? That piece of information is something that should be collected into your financial plan. And then finally, what assets do you have? And assets is a very, very broad concept. So it could be things like a 401k plan, it could be a second house, it could be a boat, it could be a diamond ring. Think about all of your assets, and we're going to talk a little bit about unique ways to maybe leverage some of those assets in the future. And then finally, you need to look at secured and unsecured debt. So secured debt is debt that is secured by something. So the best example I have is like a mortgage. So that's a debt that is secured by the property. So if you stop paying that, what happens? You lose the property. Unsecured debt is debt that is not in fact secured by anything. So think credit cards. If you stop paying your credit card company can't come and take away your house. So it's important to know the distinction between these two types of debt so that you can make educated decisions, and we'll talk about that in a little bit. So once you've sort of reassessed your entire plan, that's step one, and just kind of figured out where you are, take stock of where you are. The number one action that I suggest we all do is check your credit score and your report, which are two different things. So the score is important, but the report is just as important as the number itself. And so we are all entitled to one free annual credit report. You can go to annualcreditreport.com or call this number to get your credit report, and there's three main entities that provide credit reports. So Equifax, Experian, and TransUnion. Now, you may have seen commercials. The one that comes to mind is this really bad band that plays about credit reports. I'm sure there are others, but that's good marketing. That one sticks in my head. So there are some companies out there where they will, for a fee, get your credit report, help monitor your credit, and do all these other things. There's nothing necessarily wrong with those, but recognize that if you're asked to put in a credit card number for your report, you're probably going to get charged something down the road. If you just want to look at your credit report, not your score, but your credit report, you can go to any one of these three and get one for free. So once you have that report, what do you do with it? The first thing you need to do is look at, is everything correct? So it's going to list all the accounts and debts that you have on this report. So things like a Macy's card or any credit cards you have, any student loans that you have, anytime you've been sent to collections, those are all going to be reported on this report. So it's really important to go through and make sure that all the information is correct. So if the report is still saying that that Macy's card is open and has a balance, but you're sure that you paid it off and closed the account, you need to correct that information. And I've given you the websites here for the three bureaus, how you dispute something. There's also phone numbers you can call and whatnot. But the point here is that if the information is incorrect, you have the right to correct it. Are there things on there that you weren't aware of, didn't remember, slipped your mind? Again, really important to know what's on your credit report for multiple reasons. And then finally, how old is the damaging information? So credit reports will contain damaging information for 7 years and bankruptcy information for 10 years. And you may be able to use that information to your benefit. So let's say, for example, 6.5 years ago, you had a debt solution where you paid off a credit card for like half the amount and closed the account. Like that was the deal you made with the credit card company. Well, that's going to affect your credit and be negatively reported on your report. Now you need to buy a new car and you want some financing for that car. So the car dealership is going to look up your credit report. Well, if you know that that damaging information was 6.5 years old, maybe you want to wait another 6 months till that's off your credit report to apply for that car loan. So, of course, it doesn't always work. Sometimes you need a car tomorrow and not in 6 months, so that's not going to help you. But there are some instances where you may be able to use the timing to your benefit. All right, so after you've gotten a hold of your credit report and you know where you stand, the next step is to create a budget. And again, I recognize that this is a very sort of simple idea. I'm going to create a budget. And you may have had a budget all your life, but what I am suggesting is that you create a post-cancer diagnosis budget, because it's likely going to be different than your pre-cancer diagnosis budget. So include all of your wages. And so wages are going to be things like, obviously, the income from a job, but think about Social Security. Do you get alimony? Do you have interest from accounts? All of that's considered income. And then all of your expenses. And again, the expenses part, with respect to cancer, I really recommend that you try to foresee any repetitive or repeating care costs you might have. So include your insurance premiums. If you have an out-of-pocket maximum, I would suggest including that. So worst case scenario, if you have to pay your entire out-of-pocket maximum, how can you budget for that? So that it's not a situation where down the road you're not paying your mortgage because you're trying to pay your health insurance. Now, again, I recognize that it's a really simple thing to say, oh, create a budget. Many people feel like they can do this by themselves. More power to you. I would say there are thousands, if not millions, of free templates available online that you can download and plug in the information and customize to fit you. There's software that you can buy. So Quicken is an example of software you can buy where it will prompt you with questions and then you can answer the questions and it will kind of generate a budget for you. But even with all of those tools, it can still be daunting to create your budget, and I fully recognize that. And in those situations, I would recommend talking to a financial planner. So there is a financial planning association where you can find a financial planner in your area. A lot of times people will say to me, well, I don't really have that much money, so really is a financial planner going to work with me? Yes, because there are all different types of financial planners out there. There are some that would like you to be Bill Gates, but the reality is there's only one Bill Gates and there's a lot more of the rest of us. Some financial planners don't charge anything for their services, and the way that they in fact make money is if they, let's say, sell you a disability insurance policy or have you open up an account somewhere. There are some that charge a monthly fee, so there's all different sort of planners out there to try to fit your needs. There are also, in every state, consumer credit counseling agencies that can help you create a budget, that can help you look at any debts you might have to see if there are debt solutions. And when I talk about debt solutions, what I mean is there a way to negotiate with your debtor to pay a smaller amount to erase the debt completely? And that happens quite often. And that may be a great option for you. But please keep in mind that almost always in those situations, that will be negatively reported on your credit report. So you might be saying, well, why would I ever do that? Well, if you're somebody who has terrible credit at the moment because of what you've been through, maybe it makes a lot of sense for you just to erase all of your debt, grin and bear it for the next 7 years, and start fresh in 7 years. So again, none of these are one-size-fits-all solutions, but these are just general things for us to think about. And again, I realize it can get a little depressing, and I see the stressful looks on all of your faces. So cartoon, enter cartoon, stage right. So this is a couple talking, saying, well, we can pay off our past and save for our future as long as we avoid the present. So again, I'm really not trying to oversimplify things or to try to sugarcoat any of this. I know it can be incredibly stressful and hard to do, but these are just some tips and some things to think about to try to get you on a good path. So what happens if your credit has taken a hit? And the reality is we need credit for a lot of things. So certainly we need credit if we want something like a mortgage or a car loan. But it can also harm or benefit us in situations like a job search. So many employers will in fact look at your credit score and somehow use that number as a judgment call about whether you are responsible or reputable or whatever, fill in the blank. So there are instances outside of actually needing to access money where a credit score may affect you. The good news is there are ways to improve your credit score. So for credit cards, that seems to be something that most of us have these days. Definitely pay the minimum due on time. Even if that's all you can pay, make sure you're paying the minimum due on time every single month. It makes a big difference. Even if it feels like that balance is never getting smaller, pay the minimum. The recommendation is to make sure the balance that you keep on your credit card is less than 75% of your limit. So what that means is if you have a $5,000 limit on that credit card, make sure your balance that you maintain month to month is less than $3,750. So it's just a formula that they have where that determines that you have better credit. And please be careful about considering to pay medical bills by credit card, because credit cards generally have an incredibly high interest rate. So you could be getting yourself into quite a pickle and make a already large bill even larger in the long run. So other ways to improve your credit is by generally showing some fiscal responsibility. So how do you do that? File your taxes. Even if you made nothing and owe nothing, file your taxes. It is just a way that they look at to determine, again, that you are fiscally responsible. Pay down the bills with the highest interest rate first. Even if you have bills with bigger amounts or bigger balances, it is more beneficial to you to pay off the ones with the higher interest rate. Because if you do the math, it will cost you more to maintain a small balance with a high interest rate than a higher balance with a lower interest rate. And that can be really tricky too, especially if you have a high interest rate card that only has a limited amount. You might want to feel that satisfaction of getting rid of one bill. But again, try to look at the big picture. Build your savings. And this is one where people are like, seriously, Monica, how am I supposed to do all these things? I only get one check a month. I get it. I totally understand. But let me put it to you this way. Let's say you put all of your extra income towards paying down a bill. Let's say a credit card, and you don't put any money into savings. What happens if your car breaks down, or the freezer blows out, or the furnace blows up, and I live in Chicago, and that's not an okay thing to happen in the winter? How are you going to end up fixing that? You're going to put it back on the credit card. So all that work you've done to pay off your credit card was almost for naught, because now you have a big credit card balance again. So even if it's just $25 a month, try to build your savings up. It will make a difference. And then if you've got any left at the end of it, retirement is always a good thing, because guess what? We all get old. It happens, I've been told. So secured credit cards are an option that you can apply for, and they operate where you're actually securing the credit card by a certain amount of money. So it will basically say, I have this account with $1,000 in it. Can I have a secured credit card that I only have a $1,000 limit on it? So it helps people from getting into a situation where they don't actually have the means to pay off $10,000, and yet we're handing them a credit card with a $10,000 limit. Okay, so I also get a lot of questions about consumer rights. So what are your rights when there's been a bill that's been sent to collections? The first thing I recommend, and again, I know this sounds sort of obvious, but communicate with your creditors. So your creditors could be landlords, they could be a student loan office, they could be your hospital or your healthcare provider. Communicate with them if you're having a hard time paying the bill. They are not mind readers. And most often, they're not very good communicators either. So it's up to you to be a good communicator. So let's talk about your doctor's office for a moment. So if your doctor's office doesn't know that you got a $4,000 bill for something and you're having a hard time paying that, how can they help you? If you communicate with them, however, they may be able to come up with some sort of payment plan or deferment, or believe it or not, sometimes they can erase the bill completely. So I have an example where I got a bill for a test that was $4,000, and of course I panicked about where am I going to come up with an extra $4,000. So I called my insurance company, got all the information about how to appeal it. Then I called the lab that sent me the bill and said, I just wanted to let you know I'm appealing it, so please don't send me to collections because this is what's happening. And she said, oh, you know what? We work with that provider a lot, so ignore that bill. I'll send you out a new one for $25, and that's all you'll be responsible for. Frankly, I do this for a living. I have no idea how that works, but I didn't argue and said, thank you very much. The check will be in the mail. But again, had I not made that second phone call to the lab, I would have, A, gone through the entire appeals process with my insurance company, which would not have only been a waste of time, but it was unnecessary, but I still could have ended up paying that $4,000. So a simple phone call could end up saving you over $3,000. If you can't come up with a payment plan, ask for more time. Can it hurt? The worst they can say is no, but more often than not, they will be willing to work with you. All right, so debtor rights. So this gentleman is reading a letter from his insurance company, and it's saying, if you've already sent us your payment, please accept our apology for the death threat and the warm wishes for a holiday season. So, you know, we get a lot of mail, right? You see the doctor once, you end up with 4 pieces of mail about this one doctor's visit. There are specific laws about when collectors can call you and who they can contact. And it used to be that people were being harassed at all hours of the night, their employers were being called, all kinds of crazy things were happening. So there are now very strict rules about what they can ask for, when they can call, who they can talk to. So if you are feeling harassed, I definitely recommend that you contact the Federal Trade Commission, the FTC. Also know that if you are getting Social Security benefits, those cannot be garnished for unpaid bills. And that is a threat that many collectors will use to scare you. So just keep that in mind. Okay, so what are some income options? So that's about all dealing with income you already hopefully have and how to kind of deal with all of that. What are some additional options for income? This is where disability insurance comes into play. And there's different kinds of disability insurance. So there are private policies you could buy. There are some state disability insurance policies, but only these 5 states and Puerto Rico have state disability insurance policies. And then within all of these, there are both short-term and long-term disability. Generally, short-term is going to be less than 6 months. Long-term is going to be more than 6 months. So I'm sure we've all seen the commercials with the Aflac duck. I am not promoting Aflac. I just happen to like their commercials. But I also know that they are a great example where they're a company where if you are getting a monthly amount of less than $3,000 from them, they ask virtually no medical questions. And the reason that's important is because unlike health insurance, disability insurance plans can deny you based on a pre-existing condition. So keep in mind that if you're shopping for a disability policy and you have a pre-existing condition, you may have to go to multiple places in order to find one that you can purchase as a survivor. So just keep that in mind. We have on our website a quick guide to disability insurance that explains the differences of all of these things. We also have a blog about it as well. So if you'd like more information about these options, I would recommend that. Now, there are also 2 federal disability insurance policies, and these are both long-term disability plans. They're administered through the Social Security Administration, and the 2 different plans are Social Security Disability Insurance, or SSDI, and supplemental security income, or SSI. So what are the differences? SSDI is tied to your work history. So as you've worked, generally we pay into the Social Security system. The exceptions are some unions opt out of the Social Security system. And it's tied to Medicare. So for a lot of people, there's a confusion about the difference between health insurance and disability insurance. Disability insurance is designed to supplement the income that you're not getting anymore because you can no longer work due to your disability. Health insurance is about paying for your medical care. So in a best case scenario, you in fact have both of these things. Now, with these two federal programs, you have to be unable to work due to a disability that's expected to last for a year or longer. So SSDI is tied to your work history. SSI is tied to your income level. So if you have a lower income level, you'll be eligible, and a disability, you'll be eligible for SSI. So SSDI goes with Medicare, SSI goes with Medicaid. All right, so I just talked about the definition of disability. You cannot do your job, you cannot adjust to a new job, so you can't work at all, and you have a disability expected to last for a year or longer. So this is the process, the question and answer that the Social Security Administration will go through to determine whether or not you're eligible for either of these programs. So the first question is, are you working earning more than $1,000 a month? If the answer is yes, it stops there because you're working. If the answer is no, you go to the second question, well, do you have a severe medical condition? If the answer is no, it ends there because you're not eligible. If the answer is yes, it goes next to, well, is your medical condition on a list of impairments, which we'll talk about in a minute? Then it goes down to, can you do the work you did before? Well, generally, you're not applying for SSDI if the answer is yes, but if the answer is no, then it goes to this fifth step, which is surprising to a lot of people, but can you do any other kind of work? So just because you are a brain surgeon and you can no longer be a brain surgeon, it doesn't mean that there isn't another job out there that you could do. If the Social Security Administration can find that there is in fact another job that you can do, generally you will be denied SSDI. So this is, again, the process for SSDI. You have to have paid into the system 5 of the last 10 years. The amount that you're going to get monthly is based on how much you've paid in to the system. So I always think about SSDI as sort of a forced savings plan that we've all been forced into whether we wanted to or not. And with SSDI, there is a waiting period. So you actually don't start getting a check until the 6th full month after you've deemed to be disabled. But those payments can go back retroactively 12 months because the process can sometimes take quite a bit. So I was going to say, I hope my example's in here. So let's say that a patient applies for SSDI on September 1st for a disability that began January 1st. And that happens, right? Because sometimes it takes a while to figure out how treatment's going to affect you. Are you in fact able to work, not work? So sometimes it takes a while to figure out you should be applying for SSDI. This person's first benefit check wouldn't get to them until February. And ignore the years, because they have to wait till the 6th full month. But that first check is not only going to include February's payment, but it will also include benefits retroactive back to when the disability began on January 1st through August, because remember that you don't get paid for that 6-month waiting period. So I know it's a little bit confusing, but the idea here is just recognize that no matter what, you're going to have that waiting period of 5 months. SSI, based on low income and having few resources and fitting into a program, again, the age blind disabled program. But unlike SSDI, your benefits start immediately. To apply for either of these programs, you can go to the Social Security Administration's website or you can call them. I mentioned that there is this special impairments list, and it's called the Compassionate Allowances list. And what this is it started in 2008, and it was a list of illnesses that are going, or diagnoses, that are going to be presumptively eligible for SSDI. It doesn't mean that you're guaranteed to get SSDI, but in my mind, it just kind of makes that hurdle a little lower to the ground and easier to jump over. And there's over 60 cancer diagnoses, and thyroid cancer is in fact one of the diagnoses. So we've heard some pretty positive things from individuals with a thyroid cancer diagnosis and SSDI. Now, over 70% of all SSDI applications are denied on the first try. So this is another example of where you can't take no for an answer. Be prepared to appeal, because the rate of approval jumps drastically even with the second level of appeal. And here are the 4 levels of appeal. It's also really important to pay attention to deadlines, because there are very specific deadlines and you don't want to have to start the process all over again. And it's really critical to work with your healthcare team. So just like appealing in the individual health insurance market, when you're appealing an SSDI claim, it's really important to get your healthcare team on board, because they're going to be the ones that give you the documentation and the evidence and the support and the proof for your claim. Some instances, caregivers have to stop working to act as caregivers, right? And so what then? Some states have paid leave for caregivers. Some states have some assistance through IHSS, which is through the Medicaid program, but this is all very state specific. So I'll mention these as options and know that there's more information on our website. All right, and so this is where I want to talk a little bit about outside of the box sources of income. So you may have assets. Remember when I said think about all your assets? You may have assets that you can leverage for immediate cash. And so one example of that is a viatical settlement. And a viatical settlement is where you actually sell your life insurance policy and you get the cash now, as opposed to your beneficiaries getting the cash when you pass away. The upside is you get cash now. The downside is your beneficiaries, when you pass away, will no longer have that life insurance policy. For some people, it's absolutely appropriate. For some people, it's not. There is an alternative where you can actually use your life insurance policy as collateral for a loan. But a portion of that life insurance policy will still be there for your beneficiaries when you pass away. And so one company that we've worked with is Fifth Seasons Financial. There are others out there. I do have brochures for Fifth Seasons if anyone's interested. But they're an institution that for individuals with a serious cancer diagnosis, they will help you go through this process to determine if this is appropriate for you. So again, you're going to get immediate cash right now. You don't pay on the loan. They take over paying your monthly amounts. And in the end, when you do pass away, there's still something left over for your beneficiaries. You can pay it off. So it really is, again, being used, as opposed to selling it outright, it's being used as collateral for a loan. And I'm just bringing these up as a concept of thinking outside the box about where you might be able to access cash right now. There are also some financial assistance resources. So there's a lot of community organizations out there. There's lots of cancer organizations out there. There's some groups that offer assistance for college and higher education. There's some great fundraising platforms which are becoming more and more popular. So one that we've worked with in the cancer context a lot is Give Forward. I actually helped someone set up a Give Forward fundraiser, and it took 10 minutes to set up, and in 36 hours she'd raised like $15,000. So they do work. A lot of times you'll hear people say, let me know how I can help. And you don't always know what to say, and saying like, well, can I have a check is a little awkward. But if someone sets up a fundraiser for you or your family and you send out an email or you put it on Facebook, there's a lot of people out there that would love to help out, and this is a way that they can do it. So again, Give Forward is one that I've had personal experience with, but there's lots of them out there. There's copay assistance programs, there's prescription drug assistance programs, and again, I urge you to think outside the box with these. So you might say to yourself, well, I have money for my rent and my gas bill, but I don't have money for my premium this month, my health insurance premium. So I'm just not going to pay it. Well, think about it. Is there something in your area that can assist you paying your gas bill so that you can use the money you have set aside for your gas bill for your premium payment? So sometimes it's about juggling and you seeing what resources are out there and what you can use and piece together. These are some great options for prescription drug assistance. I would also recommend, if you have a particular prescription drug that is very expensive, contact the pharmaceutical company that makes the drug. Most, if not all of them, have patient assistance programs where they will give you the drug for a very reduced or sometimes even free rate if you qualify. There are also sometimes specialty pharmacies that you can go to get your drugs cheaper. And there's some that are here represented out in the hallway that you could go talk to. So again, really, I know we are sort of trained that we get a prescription, we go and we fill it at Walgreens or Target, and we pay whatever we pay because it's the drug that's going to save our lives or help us or whatever. I urge you to take a pause in that step and see if there are some alternatives that might help you out in the bigger financial picture. Okay, so just quick check on time. So you're ahead of me. For those of you in the back who can't quite see it, two friends sitting on a park bench chatting, saying, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. I don't recommend this as a coping mechanism, although I think some of us would probably prefer to do this. But there are some things that we can do to deal with medical bills. And first and foremost, make sure you have adequate insurance. When I used to give this presentation a year ago, this was a lot harder to tell people to go out and do because it was a lot harder for people to get adequate insurance. Not so much with the passage of the Affordable Care Act. I know some of you were next door, some of you were not. We have lots of opportunities online for you to learn more about the Affordable Care Act, but there's really no reason why you shouldn't have adequate insurance at this point in time. And it may take some juggling and some investigating on your behalf, but it is possible. Okay, before you receive care, and don't all look at me going, wait, we've already been through our cancer treatment. I realize that. But does that mean you're never going to see the doctor again? Probably not, right? You're probably going to keep seeing the doctor and keep accessing medical care. So there are some things that you can do before care to lower those bills. Talk to your doctors about lab work. I know it is so easy when they say, we need blood, you stick out your arm, they take the vial, you don't know where that vial goes, and then you get a bill. Have the conversation with them about what lab are you sending this to, and know what labs are in network for you, because that can mean the difference between having that lab work covered and not covered. And if the doctors don't really care where they send it, they're going to send it to whatever's easiest for them, unless you say, I need you to send it to Quest Labs, I need you to send it to XYZ Labs, because that's what my insurance covers. Shop around for tests. So there's a lot of insurance plans which will cover tests like MRIs or CAT scans if you go to a standalone facility. In Chicago, they're all in strip malls. You see like the MRI imaging centers. My insurance plan will cover those at 100%, but they only cover them at 75% if I get them at the hospital. That could be a big 25% difference, right? But it's the same scan that you're getting. See if there are cheaper or generic medicines that you can be taking. Again, I am not a doctor. I am not recommending that you change your care in any way. But some doctors, they just get used to throwing out that prescription drug name. Ask, hey, is there a generic that works just as well? They might go, oh yeah, here. They just don't necessarily, we love our doctors, our healthcare professionals are amazing. They don't always think about being in the shoes of a patient. So that's your job to remind them of that. All right, after you've gotten treatment, these are the pieces of information you will end up getting, usually. Usually from your insurance company, you'll get a letter in the mail saying, we've gotten a claim. You're not supposed to do anything with that, but they're just letting you know you've gotten a claim. Then you get another letter sometimes saying, well, we're processing your claim. Again, you're not supposed to do anything with that. The third piece is going to be your explanation of benefits, or an EOB. This is a very important piece of paper because this is going to show you what the insurance company has received from the doctor's office and what they're going to cover. This is your opportunity to look for mistakes. So it might say you received hospitalization on the 21st and you're thinking, I got discharged on the 20th. Call and ask about that kind of stuff. A lot of times you'll get on an EOB, it'll just be numbers or it'll just say lab tests. Not so helpful. Call and ask. What lab tests were ordered? What is this $86 charge for? And when I say call and ask, generally you want to call your provider, so your doctor's office that's doing the billing. Because guess what? Who does billing? Humans. And what do humans do? Make mistakes. There's ringers from my last session, right? People make mistakes. And so don't just blindly pay a bill that you get, because there's more than likely, I shouldn't say more than likely, there's oftentimes mistakes or things that could be adjusted. I also don't recommend, because the next piece of information you'll get is going to be a bill from the provider, from your doctor, saying, well, insurance covered all of this, here's what you owe us. Oftentimes, your doctor's office is faster than the insurance company. So you get that bill from the provider before you get the explanation of benefits. I do not recommend paying that bill until you get the explanation of benefits so that you can match them up. The other issue is you have to look at your deductibles and out-of-pocket maximums. Because it may be you've seen the doctor twice more since you've gotten this bill or this EOB, and you've hit your deductible, and that just being reflected in your doctor's office bill. So you may end up paying more than you're supposed to. So my recommendation is you don't pay anything until you have the EOB next to the doctor's bill, and you can match them up, and then you pay that bill. If your doctor's office tends to lump a bunch of visits into one bill, you can actually subtract them out. So I have a bill here that has services for the 27th, the 30th, and the 31st, but I only have an EOB for the 27th. Match those up, pay the amount for the 27th. Guess what? The doctor's office will send you another bill for the 30th and the 31st. It is much easier to do it that way and to keep track of it that way than to just pay the bill and then try to recoup money that you might be owed later. Does that all make sense? Great. Okay. So create an organizational system. Again, this sounds sort of simplistic, but it can be so overwhelming, all the pieces of paper that you end up getting. There are some planners that are already out there, so Cancer 101 has one, Livestrong has one. Really, use any system that makes sense for you. File folders, 3-ring binders. I don't recommend the shoebox approach, but but I guess if that works for you, that works for you. And these are the things that you want to keep track of. So explanation of benefits. Did you get a prior authorization? Keep a hold of that. I write down every time I call my insurance company, even if it's for a simple question. I talked to Jane on the 27th at 8 a.m. This is what we talked about. This is what she told me. Because you never know when you're going to need to go back and reference that phone call. And if any of you have memories like mine, you don't keep all of that information in your brain. Also, keep track of meals, transportation, lodging. If you're going somewhere else for treatment than where you live, those expenses may be deductible on your taxes. So keep track of all of that information. All right, so bankruptcy. Bankruptcy is a hot button topic. I get a lot of questions about it. I would say bankruptcy is a wonderful tool for some people, but it is not necessarily appropriate for everybody. If you've ever heard me talk, you've seen this chart before in the past, but I think it's really, really important to recognize because I think there's a lot of emotional feelings attached to bankruptcy. I just want to point out that in 2009, when this study was done, it found that 62% of all of the bankruptcies in the United States were due to medical debt. And what is more concerning about that is of those 62% that claimed bankruptcy because of medical debt, 78% of them had insurance. So these are individuals who were doing, what they were supposed to be doing. They had insurance, they were paying their premiums. The only thing they did wrong was get sick and have these huge medical bills. So if you are contemplating bankruptcy and feel like that is a viable option for you, please do not feel like you are alone. It definitely happens. Hopefully with the passage of some of the reforms in the Affordable Care Act, it will happen less, but it will still likely happen. If you are contemplating bankruptcy, I recommend getting the assistance of an attorney. Bankruptcy is a very complicated process and it's very hard to navigate. If you feel like you can't afford an attorney in the traditional sense where you go to a lawyer's office and sit down and pay a retainer, there are some options. There are some online options. LegalZoom is one example where they will help you through the process for about $2,500. A lot of people don't realize that it actually costs quite a bit of money to file bankruptcy, believe it or not. There's also some free assistance out there if you meet income levels. So lawhelp.org is a great source to find pro bono attorneys if you're considering bankruptcy. But it's really, really important to understand bankruptcy, and there's different types, and I'm not going to get into the nitty-gritty of it today. I will say we have a guide to bankruptcy on our website that does kind of get into the nitty-gritty of it, but also recognize that it's a process. So it can take 4 to 6 to 12 months to actually get through bankruptcy, and it can be not only a financial toll, it can also be an emotional toll as well. So just to put that out there. We have a ton of resources. I know I keep pointing you back to our website. Again, I think this is an emotionally charged topic. There's lots of information that I'm throwing at you. So I don't want you to feel like this is your last opportunity to get information. And that's how you can find us. And with that, I will take questions. But we've been asked to ask you to go to the microphone in the middle of the room to ask questions. Wow, nothing? I explained everything perfectly. I love days like that.
Okay, so first actually is, can you potentially send us the presentation? There's a lot of websites and stuff that I couldn't really quite get.
So I would say instead of getting the presentation, go to our website, and on the guide you can see all of these links.
Okay, cool. And so you kind of touched on this, but can I appeal bills that I paid last year and get money back? I mean, so last year I had my surgery, I had my REI, and I didn't, there was a lot going on. So I don't know if maybe I could have appealed things potentially.
So generally, yes, you can. It can be quite a process, but you can certainly do it. There are also some companies out there that will help you do this for a small percentage. So one that comes to mind is Med Claims Liaison. There are many out there, bill review services, and the way they operate is you basically hand them your shoebox, which I don't recommend that being your process, just the caveat, I'm being recorded, so you know. And they will go through it all and actually find out, are there places where you overpaid or you were mischarged, and then if they get you money back, they will take a percentage of that, what they get you back. If they get you back nothing, then it costs you nothing. So that might be something worth looking into.
Okay, thanks.
You're welcome. Anything else? I know it's the end of a very long day, and some of you have now listened to me talk for 2 hours straight. Well, I hope that you will visit our website, sign up for our newsletter list, join us on webinars. We'd love to hear from you again. And thanks for hanging out with me for another hour. Have a great rest of the conference. Take care.